Is TB in children contagious to other family members? This is an important question many families may have when dealing with tuberculosis, commonly known as TB. Tuberculosis is caused by bacteria that mainly affect the lungs. Whether TB in children is contagious to other family members depends on the type of TB the child has. First, let's talk about latent TB infection. Children with latent TB carry the bacteria in their bodies, but these bacteria are inactive. These children do not show any symptoms and are not contagious. They cannot spread TB to others. It is crucial to treat latent TB infections to prevent them from progressing to active TB disease later on. Now, when we look at active TB disease, things change. If the TB bacteria become active and multiply, the child develops active TB disease. This form of TB can be contagious, especially if it affects the lungs or throat. When an infected child coughs, sneezes, or even talks, they releases tiny droplets into the air that contain the bacteria. Family members and close contacts can be at risk of infection if they are exposed to these droplets for a prolonged period. Interestingly, children are generally less contagious than adults. This is because young children usually have fewer bacteria in their sputum and are less likely to produce forceful coughs. However, older children with productive coughs or those with cavitary lung disease can still transmit TB. To protect family members, early diagnosis and treatment of active TB in children are essential. If a child is diagnosed with active TB, family members should be screened for TB. Maintaining proper ventilation and practicing good respiratory hygiene can help reduce the risk of transmission. In some cases, isolation during the infectious period may be necessary. Additionally, treating latent TB infections in exposed family members can prevent them from developing active disease. In summary, TB in children is contagious to other family members only if the child has active TB disease, particularly if it is pulmonary TB. Children with latent TB infection are not contagious. The risk of transmission depends on the child's disease state and how close family members are to the infected child. It is vital to seek prompt medical evaluation, diagnosis, and treatment to protect family members and control the spread of TB.